Good afternoon and welcome to today's Project Echo ODMAP. Today we're talking about the history of ODMAP and requesting access for access. So if Emily will start with housekeeping tips.
Good morning, everyone. My name is Emily Field, and I am the Senior Evaluation Specialist here at USET. Towards the end of the hour, I will share a link to get that's going to be a survey link for evaluation for how this echo is, and hopefully get some feedback from you on how we can improve these. And I would also like to invite everybody to share your name and tribal citizenship affiliation and or intertribal organization affiliation. We're trying to gauge how good a reach we're getting with these different echo calls. And so if you could share that in the chat, including everybody at USET, that would be amazing. Thank you. And we're being recorded.
And we can turn it over to Mark and Vicki.
All right. So today is our second week. So we're going to be talking about the history of ODMAP and requesting access. So I'm going to share my screen here real quick. Let's see. Okay. All right. Can you all see that? Okay. Real quick, I got two screens up. So which screen are you seeing?
We're seeing the PowerPoint
Okay.
with not the presentation. Yeah.
Okay. So are you seeing the presentation now or the?
We're seeing the presentation mode. If you can click on the ellipses, the three dots.
Right over here.
Under the
Screen sharing for this one.
No.
Let's see. I'll change it over here. Let's see. Nope, that didn't work either, did it?
Yeah, there's three dots below where it's the background slide.
Yeah, let's see. Oh, yeah, those three dots are not coming up on here. Let me see if I can try something else.
For those of you who have just joined, if you could go ahead and share your name and tribal or intertribal affiliation in the chat, that would be amazing. Thank you.
Okay, now how's that?
Yeah.
Okay, got it that time. Sorry about that. Okay. So let's go to the second slide here. So background, challenges related to timeliness and accuracy of overdose data. So this is what they identified. So this is the background behind why they actually started ODMAP. So first responders, public health officials, and other stakeholders had to wait on medical examiners and coroners to confirm overdose deaths through toxicology tests. So this could take a few weeks before they actually get the data. So that's one of the challenges that they had, and they tried to figure it out. Toxicology tests also struggled to keep pace with the rapid emerging synthetic opioids. which resulted in undercounting of overdoses. Then there's siloed data. So stakeholders such as public health, fire, EMS, law enforcement often kept separate data sets, resulting in not knowing the full totality of the overdose issue in the community. So this is right here is the HIDA. So it's a high intensity drug trafficking area. So the origins of ODMAP started back when HIDA was first created by Congress in 1988. So there's currently 33 different programs, and HIDA has a budget of $290 million. So in the fall 2016, the Washington-Baltimore HIDA met to discuss different approaches to deal with the opioid crisis in Baltimore. And as we said earlier, there's siloed data and a lot of issues with reporting timeliness. So a little bit about HIDA again. Congress created it to address regional drug threats with the purpose of reducing drug trafficking and drug production in the United States. The goals for HIDA are to disrupt the market for illegal drugs by dismantling and disrupting drug trafficking and/or money laundering organizations, and to improve efficiency and effectiveness of HIDA initiatives, which ODMAP is now one of the HIDA initiatives. And so following their 2016 meeting, the Washington-Baltimore HIDA began developing an interface that could track and map overdoses across jurisdictions. Key features about this interface was the ability for first responders to enter data while on scene. ODMAP platform was then launched only in the Washington-Baltimore area in January 2017. After seeing it in action, other HIDAs became interested in ODMAP and launched nationwide in April 2017. So this is just a little bit about the growth of HIDA, of ODMAP. So, and you see on the left there in 2017, there was only 136 agencies that used ODMAP. And then in 2020, it's all the way up to 3,300 now. And that's 2020. So this was, I believe, July that they took this data from. So it's even further up there now. So ODMAP data monitoring usage, that's another. You'll see that it's grown exponentially. It's mainly still used by law enforcement, but other agencies, public health, government organizations, fire, EMS, they've all started using it as well. And ODMAP aims to be the standard in overdose detection and to be used in all agencies across the United States. And now I have a little video to show you just about the history of ODMAP.
Traditionally, states and our nation as a whole has been really good at tracking fatal overdoses. Non-fatal overdoses, not so much. Non-fatal overdoses are just as important as fatal overdoses. We shouldn't have to wait for someone to die to know their number.
How many overdoses occur in your jurisdiction in a given day? Now, 3 years ago, nobody knew. Nobody knew.
And that's hard to keep up with from a public health perspective, from a public safety perspective, when the drug environment is constantly being changed. It's hard to detect, it's hard to stop.
And criminals are so creative with the way that they put drugs into our communities, right? Our adage that we hear from a lot of our partners, that they mail drugs and fentanyl. If it fits, it ships.
And what if you were able to share information and perhaps know ahead of time of when a spike is going to occur in your community?
My boss, Tom Carr, director of the Washington-Baltimore HIDA, attended a meeting in Baltimore City. It was a bunch of academics, some health folks in the room, and they were starting to sort of determine how best to get a handle in real time what was happening on any given day, how many overdoses were occurring in Baltimore City. And somebody joked, we ought to have an app for that. And of course, our boss, Tom, who's this innovative person, came back and he said, let's build something. It was my third day on the job. And he said, you guys got 30 days to build this system, go to it. And we did. So ODMAP stands for the Overdose Detection Mapping Application Program. And that's what it is. It's a syndromic surveillance system designed to allow us to quickly and accurately understand the drug threat in a particular area.
The majority of people that use ODMAP are going to be law enforcement, public health, fire, EMS, medical examiners, and coroners. ODMAP is a place for everybody to come to the table, to have a seat, to be heard, and to share that information.
We kept it as simple as possible. So within 2 seconds, they can say, I'm here, I'm at this location, and there's an overdose. And that reports back to a system that multiple people in our public health and public safety partnerships and teams have access to.
ODMAP is really the first time that they may be coming together to talk about sharing data.
With a system like ODMAP, I know this area, this is where we have the highest percentage of overdoses in a community. That's where I need to put Narcan and naloxone. That's where I need to put my resources. So on any given day, a public health chief could look at their county or their local jurisdiction and get a great sense of what was going on.
We're very fortunate that people around the country continue to involve us in the work that they're doing, telling us how ODMAP is being put into action.
So we all of a sudden now have a conference we'll present at, or somebody will take a look at our website, and then they'll call us and they'll say, look, you know, we had too many people die. We had too many overdoses last year. We just need to get a better visualization and a better understanding of where it is. So going from, you know, back in 2017, where we were calling and saying, hey, we got this great tool, why don't you use it, it's free of charge, to now folks calling us and saying, hey, we got a budget, we want to buy this thing. And we said, no, it's free. It's a tool for you to use for free.
We're all very dedicated to this. We believe in it.
Wake up thinking about how to improve a system that helps save lives. We go to bed at night thinking about it. I mean, how often do we call each other or send an email or a text and just say, hey, I just thought of this, let's give this a go. Or I just saw this documentary, I just saw this news article. Maybe we can tweak ODMAP to do this thing. And I just think it's that passion that we bring. We're trying to create solutions that are effective and easy to sort of put into practice right away.
We feel very strongly that ODMAP should always be free. This epidemic has wreaked havoc on our nation. It has killed people. The last thing that communities should have to do is have to pay for something to save lives. And so that is where I think there's a strong impact.
Okay. And so that was a little bit of history behind ODMAP. And now we're going to get into, here's another video about actually applying for ODMAP, having access to it. So this is another short video.
Hi, my name is Elise Alter, and I'm the ODMAP Program Manager. Today we're just going to do a brief overview of how your agency can request access, resources that are available to you and your agency, as well as how to get in contact with our help desk if you have any questions or concerns. First topic we will cover is how to request agency access. As a reminder, ODMAP is only available to those government entities serving the interest of public safety and/or public health as part of its official mandate. ODMAP is also available to licensed first responders and hospitals. If your agency would like to request access and meets the qualifications above, you can just navigate to odmap.org, click on Agencies, scroll down, and click on the Request Agency Access button. Once you click that button, you will be taken to this form. The form is self-guiding. However, I will take a moment to point out some important fields. The first is the person that is designated as your agency's signatory or signer should be someone who's authorized to sign documents on behalf of your agency. This is typically someone such as a chief of police and his or her designee. The person designated as an agency administrator is responsible for overall user, agency, and alert management for your agency. So they're really the gatekeeper for your agency and will help onboard users. Once you onboard your agency, you can choose to designate additional agency administrators if you need to. Once you click the Submit Request, you will receive confirmation that your request has been received and we will be in contact with you soon. You will also receive a verification email as well. Once you receive your ODMAP participation agreement at the ODMAP program office and we verify that your agency is authorized access to ODMAP, we will approve your agency and the agency signatory will receive an email with an electronic participation agreement. Additionally, the agency administrator will receive confirmation that the participation agreement is currently being signed by the agency signatory. Once the agency signatory clicks that link for the ODMAP participation agreement, they will review it and then ultimately enter in their initials and sign the agreement to execute the document. Now we will transition to available resources that are open and out there to your agency free of charge. The first, you can navigate over to odmap.org, click on training, and we offer weekly demonstrations every Thursday at 1 p.m. Eastern Time. If you'd like to register for one, you can just click on the hyperlink and it will give you the necessary information to call in. We also have online training that's available to you both in PowerPoint form, video form, and training manual form. So again, just go over to odmap.org and click on training. ODMAP also has a user community where you can take a look at past user webinars, which we have every month that are available to all ODMAP users. If you're not currently part of the user community, you can request access by emailing the ODMAP newsletter at wb.haida.org. Once we receive your request and we verify that you're an active ODMAP user, an agreement will be sent to your email address for you to sign and return back to us. As I mentioned previously, we also have monthly newsletters. These will be automatically disseminated to all ODMAP users, so there's no request that needs to be initiated. You will just start to receive these typically within the first week of the month. And then lastly, I will just cover our help desk. If you have any technical questions or concerns, they are available to you Monday through Friday from about 8:30 to 4:30 Eastern Time. You can also email them directly if you wish. As a reminder, we are checking for any critical issues 24/7. That concludes the webinar for today. If you have any other questions or concerns, you can find our contact information at odmap.org. Thank you.
Okay. And so the link to access, I can post this into the chat box for everyone. But once the form is submitted, you'll have to have a signatory. So signatory will receive the email with the link of the electronic participation agreement, as she said. For the signatory for us, for EBCI, we had our EMS chief. He was our signatory, and we put him also as the agency administrator. And then once we got everything processed through, we requested an additional agency administrator who was also in EMS. And so this is just a slide from the video, just so y'all can remember. Just make sure you put the signatory. So this person has to be someone that is authorized to sign documents on behalf of the agency. And the person designated as agency administrator is responsible for user, agency, and alert management. So this is going to be for your spike alerts and adding other individuals onto ODMAP. Okay. And then I have one other small video, short video, and then we can take a look at the actual form online.
We have stigmatized substance use disorder in America. In the past year, a friend of mine in Memphis actually committed suicide. This was an individual who had struggled with alcohol and drug addiction issues for really 30 years or more, and at the end of his life decided that he just simply couldn't do it anymore. And this was an individual who was a minister. He performed the wedding for me and my wife.
I think one of the biggest challenges is just us at the health department, there's only so much we can do.
Shelby County has about 940,000 residents. We're one of the largest cities in Tennessee. Our EMS responders are going out about 8 times a day on average for a response to a drug overdose.
Now we're seeing that we're actually having more overdose deaths than car accidents. So it's definitely a real issue.
Our main role in the substance use disorder response is to convene and collaborate with many partners in the community. Our coalition has about 40 to 50 different partners, which includes law enforcement, first responders from 7 municipalities, but also the treatment community, the academic community, the prevention community, harm reduction. ODMAP is a tool that lets us see the epidemic unfold as it's occurring, and also helps our entire coalition pinpoint areas of our community that are experiencing more overdoses than other areas. We can detect spikes, and when something has changed, then we're able to say, wait a minute, something is going on in the community. We can share that information with the Prevention Coalition.
ODMAP has been great, and it really doesn't pose any issues against HIPAA. There are little to no costs involved.
Over 3,000 agencies across the country are using this tool right now.
ODMAP is allowing us to see what's happening, on a day-to-day basis, and also watch for spikes in activity and be able to notify the community about those. It can be discouraging at times, but if we didn't have this program, there's no way we would even be able to address it in the ways that we're addressing it now.
45 people are alive today who, statistically speaking, we would have expected to die without the work of the coalition. Some of the stories are heartbreaking, some of the stories are tragic, but we also see the opportunities that are being realized in responding to this epidemic.
All right. And let me end this here. Okay. I wanted to show you that just because you can get a kind of a idea from the local health department level, how they're using it at that level. Let me show you the map or the agency request. So when you do go and request access, this is what you'll be going to here. So just make sure you have the agency name there, agency identifier, agency type. So you'll have all these here. And if you have any questions, you can contact ODMAP directly for all this stuff here. Agency use case explorer. So this is used by the police departments. So if your police department uses that, that's associated with HIPAA, so they can kind of integrate that in there. So we don't use that here, but it's something interesting that you could use and kind of integrate it in there. And so there's only actually level 1 access now. They actually got rid of level 2 access. So everyone has level 1 access. So that's something new that just came out. And I believe that's all I want to share for today. And we can open it up to questions and comments and questions if you want.
Thank you for a great presentation. Do we have any questions right now for Mark Tuttle or Vicki Bradley?
I think, Brian, if folks are interested in using ODMAP, it's pretty simple, as Mark just went through, to get registered and get started. The best thing is just kind of get in there and just kind of play around and see what other communities are doing and look at the types of data that you can pull up. That was helpful for us when we first gained access, was just to get in there, see what it looked like, pull up different parts of the country, even different areas, that we had tribal lands in. And so we could see what we could potentially do with it.
So it doesn't hurt to just get access and poke around.
No, you can't harm the data. You can't change the data, right, Mark? I mean, it's not the way it's set up is you can look, but you can't go change someone else's data without having administrative access to their system.
Stephen had a question in the chat. Does level 1 now have access to level 1 and 2 abilities?
Yes. Yeah. So level 1, so they have, I'll try to show you. Let me pull it up and I can try to show it for you. I can log into it here. Let me share my screen.
Mark, while you're pulling that up, so there's level 1 access, but there's still access for, say, first responders that enter data. That's not considered a level 1, correct?
Level 1 is for you can enter the data, but you have to still have special privilege in order to enter the data. So I'll show you here. So for this, so if I wanted to, I could go in here. This is how they enter the data here. And so you just enter all the information here, the case, age, all the suspected drug, vehicle involved, and you can enter all that here. But then this is basically the level 2 part right here. So they originally, this national map beta right here, this was totally separate. So only people with level 2 access could view that. But now they've kind of combined them both together, so everybody has access to the one. But for like managing overdoses and stuff like that, I don't have access to that. Only our Cherokee Tribal EMS has access to it. Hopefully that answers some questions.
Thank you. Do you have any other questions? Okay. We can go ahead and end today if there's no other questions. Thank you for a great presentation again, Mark and Vicki. And join us next month when we discuss, oh, I lost it.
The data entry, management,
Data entry.
setting overdose spike alerts.
Yep.
And please complete the survey if you could. I just placed it in the chat.
Yes, it's in the chat and it'll help us gauge activity levels. And yeah, I don't have anything else. Y'all have a great day. Thank you.